Hey, it is Wellness Wednesday, and today Dr. Ken Stewart, KCU Assistant Professor of Primary Care, has some ways on how to protect your kidney health. It's great to have you on the show. Absolutely fascinating guest. Next month, we want to talk to you maybe about your trip to Guatemala. You just got back from Guatemala, helping out so many people down there.
Yeah.
Stories are great, but we got to talk kidneys right now.
Got to talk kidneys, yes.
All right, what does my kidney do? I mean, everybody has kidneys, but it does some absolutely essential.
Absolutely. They're the filtration system of the blood. They filter all of the blood. They remove toxins. They remove excess water. They maintain balance for important elements like calcium, and they control your potassium, control your phosphorus, all those really essential minerals. Kidneys are responsible for taking care of.
So they have to be kept in great shape.
Yeah.
And it's very, very important to be aware of any potential kidney diseases. It turns out we lose a lot of people every year because of chronic kidney disease.
36 million people in the United States.
Wow.
Yeah, and the majority of those don't even know they have kidney disease.
Which kind of puts it in that same category as diabetes. There are so many people, so many diabetics out there who really don't realize that they have diabetes.
Absolutely.
What are some signs that we need to be looking for so that we can go to you or to a doctor to find out whether we might have kidney disease that's becoming chronic?
So Gary, you kind of touched on one of the causes for kidney disease, which is diabetes, uncontrolled diabetes. And if you don't know that you've got diabetes, then you might not know that you potentially are going to develop kidney disease. The other contributing factor to kidney disease is high blood pressure. So those two diagnoses alone lead to about 2/3 of kidney disease candidates.
Okay, at what point when you have kidney disease, I'm sure there's a level that you reach where it becomes chronic. What is that point?
It's at the point, if you test the blood, there's certain blood values that you can test. It's a very simple blood test. Will tell you whether or not you're developing kidney disease. And based on those values, the BUN and the creatinine, will tell you whether or not you're developing kidney disease. So I would tell you if you're having excessive urine, which is one of the symptoms of diabetes, or you're not making what you feel is enough urine and you're retaining fluids, you might want to go see your doctor and get that checked out to make sure you're not having kidney problems.
And this is a fairly common part of the regimen of blood tests, of the information that they will get from a blood test when you go in, right?
Yes. So if you go in for an annual physical, you're going to get blood work done. Depending on how old you are will determine what kind of blood test you'll get. So, you know, older men would get a PSA and a complete blood count, and just kind of looking for those screening tests to find out if there might be something that you're suffering from. You don't know it.
Whenever you're on, we talk about risk factors. And I'm always amazed at how many risk factors are the same with all these different conditions. Yeah. Smoking obviously affects almost everything that happens inside your body.
Yeah, smoking is no good.
Yeah, don't do that.
Don't smoke.
Right.
Yeah, exactly. Then there are other things, you know, blood pressure, obviously blood pressure. If you're taking blood pressure medications, make sure you're taking those blood pressure medications as prescribed. Don't miss any doses. Don't try to adjust them on your own. Watch your salt intake. Watch your diet.
Okay.
Again, exercise will help lower your, diabetes. If you've got diabetes, it'll help lower your blood sugar. So exercise, good diet, limiting alcohol, limiting fatty food intake, kind of the things we've been hearing all along about maintaining good health, keeping the cholesterol down.
All of these things are going to help us to avoid the kidney disease that can kill so many people here in the United States.
Absolutely.
How is it prevented? Is it prevented by, at an early age, maybe you feel compelled to make sure that your children or your loved ones are doing the right things?
Yeah, watching your salt intake, making sure you're well hydrated. Sometimes kidney disease or kidney injury can occur from being dehydrated. And so that, if the kidneys aren't able to filter out enough of the blood, that can cause damage to the kidneys. Now that can be reversible, but if it becomes progressive, the earlier you can catch it, the better off you are, and the more likely is you can save your kidneys. Ultimately, if you have progressive kidney disease, you have to be concerned about going on dialysis or having to have a kidney transplant. Right.
They're wrapping us up, but I want to touch on one really quick thing that you kind of alarmed me on. And I have some osteoporosis, so I take some Advil, and I take maybe more than I should, and that can affect my kidney functions?
Yeah, so if you're on chronic non-steroidal anti-inflammatories like ibuprofen or naproxen sodium, those kinds of things are actually harmful to the kidneys. And so you want to be very, very judicious in your use. If you're using them for a long-term period, you want to make sure you check with your doctor who's prescribing those, because they're going to want to monitor your kidney function and make sure you're not developing kidney problems.
Great. Learn so much when you are here. Can't wait to hear about the amazing things that you guys do in Guatemala. I got to see a video of you getting a standing ovation from helping. You and what, 42 different doctors helped 500 people in Guatemala on one day.
Yeah.
I was blown away by that.
We
want to hear that story sometime.
Absolutely. I'd be happy to share it.
All right. Thank you so much,
Thank you,
Doctor.
Gary.